Yeah, go ahead.
Sir, my topic is complementary and alternative therapies and anesthesia. This is the topic I prepared from Miller's chapter 33, 9th edition, sir.
Hmm. Yeah, go ahead.
The complementary medicine is defined as the addition of non-conventional therapies to the accepted treatments. An alternative medicine is defined as the use of non-conventional therapies in lieu of accepted treatments. They are also called integrative health or integrative medicine. Most commonly used complementary and alternative medicines are natural products, rebreathing exercises, meditation, chiropathic or osteopathic manipulation, massage therapy, yoga therapy, non-herbal dietary supplements, acupuncture, music therapy, etc. There are the classification of there are three major categories, mainly the natural products. There are variety of herbal products, vitamins, minerals, and probiotics. Second is the mind body practices, which are yoga, chiropathic or osteopathic manipulation, meditation, massage therapy, acupuncture, relaxation techniques such as breathing exercises, guided imagery, progressive muscle relaxation therapies, Tai Chi, Yin Yang, and hypnotherapy. Others are traditional healers and Ayurvedic medicines, traditional Chinese medicines, homeopathy, naturopathy, and functional medicines. The first, the herbal products. Herbal products can affect the perioperative period through several mechanisms. First is the direct effect through their intrinsic pharmacologic effect. Second, pharmacodynamic interactions, mainly through the alteration of action of the conventional drugs. And third is the pharmacokinetic interactions, that is alteration of absorption, distribution, metabolism, elimination of the conventional drugs. Uh, Generally, according to the guidelines, herbal medicines to be discontinued 2 weeks before surgery. And some of the herbal medications used are echinacea, which has a pharmacological effect of activation of cell-mediated immunity with the perioperative concerns of allergic reactions. It decreases the effectiveness of the immunosuppressants. It is a potential immunosuppressant, and uh, regarding discontinuation of surgery, there is no proper published data set. And second, ephedra, it increases the heart rate and the blood pressure through its direct and indirect sympathomimetic effects. And regarding perioperative concerns, it has a risk for myocardial ischemia and stroke with the increase in heart rate and hypertension, and it can cause ventricular arrhythmias with halothane. And long-term use of the ephedra uh, has an endogenous catecholamines, and it can cause intraoperative hemodynamic instability and life-threatening interaction with the MAO inhibitors, and it should be discontinued 24 hours before the surgery. And garlic inhibits the platelet aggregation, and which may be irreversible also, and it increases fibrinolysis, and it increases the action of the antihypertensives used along with this. It has a risk of bleeding, and with combined with other medications, it can inhibit platelet aggregation, and it should be stopped 7 days before surgery. And ginger, it has antiemetic and antiplatelet aggregation action. It may also increase the risk of bleeding, and regarding discontinuation of the surgery, there is no data set. And Zingo, it inhibits the platelet activating factor, and it also increases the risk of bleeding, and when combined with the other medication, it can inhibit the platelet aggregation. And discontinuation before the surgery, it should be discontinued 36 hours before the surgery. And ginseng, it lowers the blood glucose, it inhibits platelet aggregation, which may be irreversible, and it increases the PT and APTT in animals. And regarding perioperative concerns, patient may have hypoglycemia, it may increase the risk of bleeding, it may decrease the anticoagulant effect of the warfarin. It should be discontinued 7 days before the surgery. And green tea, it inhibits the platelet aggregation, and it inhibits the thromboxane A2 formation, and it also increases the risk of bleeding, and decreases the anticoagulant effect of the warfarin. And it should be stopped 7 days before surgery. And kava, it has sedation and anxiolysis, may increase the sedative effect of the anesthetics, and it increases the anesthetic requirements if covers used for long term, and it should be stopped 24 hours before surgery. And some sapamato, it inhibits the 5-alpha reductase and cyclooxygenase. It may increase the risk of the bleeding, and there is no data for discontinuation before surgery. And John's wort, it inhibits the neurotransmitter reuptake and MAO inhibition, and induction of it has an action against cytochrome P450, and it affects the cyclosporin, warfarin, steroids, and protease inhibitors metabolism, and decreased serum digoxin levels and delayed emergence. It should be stopped 5 days before surgery. And the valerian, it is a sedative, and it may increase the sedative effect of anesthetics and benzodiazepines, um, and it may increase the anesthetic requirements with long-term use. And regarding discontinuation before surgery, there is no data, sir. And other herbal medicines are soy, isoflavones, grapeseed extract, and milk thistle. There are no adverse effects reported against these. And Baldo, Pansan, Dongwai, and Papaya, they are stopped 2 weeks before surgery, since it has antiplatelet aggregation activity, and it has herbal and conventional drug interactions. The common dietary supplements are vitamins, minerals, amino acids, enzymes, and animal extracts, prebiotics and probiotics. The the commonly used are coenzyme Q10, glucosamine, chondroitin sulfate, and fish oil. The coenzyme Q10 is a single constant antioxidant structurally related to the vitamin K. It prevents the transition of pore from opening, and it counteracts with several apoptotic events such as fragmentation, cytochrome C release, and membrane potential depolarization. It interacts with the total serum clearance of the warfarin, and it should be discontinued 2 weeks before surgery. Glucosamine and chondroitin sulfate, it worsens the diabetes in animal models. It interacts with the warfarin. Coagulation alteration is there, increased in INR, increased bleeding or bruising is there. It should be discontinued 2 weeks before surgery. Fish oil, it generally reduces the inflammation and the inflammatory process of the cardiovascular diseases and inflammatory bowel diseases, cancer, rheumatoid arthritis, and neurodegenerative illnesses. It inhibits the platelet aggregation and increase the bleeding risk is there, and uh, by decreasing the cyclic the CMP levels of the platelets, and it interacts with the warfarin, causing increased INR, and along with omega-3 fatty acids. It should be discontinued 2 weeks before surgery. The prebiotics and probiotics, um, these are non-digestible food ingredients, selectively stimulating the growth and activity of one or a limited number of bacteria in the colon that has potential to improve the host health. The probiotics are live microbial feed supplement that beneficially affects the host by improving its intestinal microbial balance, targeting the gut microbiota, using the fecal transplantation or fecal capsules to treat recurrent Clostridium difficile infection are in use. Gut microbiota modulate the central nervous system function, including the anxiety or depression and cognition. The other dietary supplements are flaxseed oil, fiber or xylem, cranberry, melatonin, methylsulfonyl methane, and lutein, but these have no recorded or published perioperative risk. Next is the acupuncture. Acupuncture has a preoperative anxiolysis. It can reduce the intraoperative anesthetic requirements and postoperative ileus. It is mainly used for the postoperative pain management. Acupuncture is a traditional Chinese medicine, and it has 12 bilaterally distributed channels, 6 yin channels and 6 yang channels, in conjunction with the 2 midline channels in the ventral and dorsal aspects of the body. And the stimulation of the anatomical locations on the skin by variety of techniques that can be classified as invasive needles or injections, or non-invasive TENS or pressure laser. Um, The invasive stimulated by the manual manipulation, moxibustion, pressure, laser, or electricity. The acupuncture stimulates a high threshold, small diameter nerves that activate the spinal cord, brainstem, especially the periaqueductal gray area, and the hypothalamic arcuate neurons, which trigger the endogenous opioid mechanism. The effect of the acupuncture analgesia can be reversed by the administration of the naloxone, which demonstrate the mechanism of action of acupuncture by endogenous opioid mechanism. The other mechanisms such as modulation of the immune function, inhibition of inflammatory response, regulation of the neuropeptide gene expression, and alteration in hormonal levels have been demonstrated. With the help of the PET and functional MRI, thalamic asymmetry in the chronic pain syndrome persons, it has been reduced after acupuncture, and there is activation of the visual cortex after acupuncture. Next is the deep breathing exercises. Deep breathing exercises are performed as a part of the relaxation technique. With this method, a subject consciously slows breathing and focuses on taking deep breaths. Deep breaths can help reduce abdominal and surgical pain. Studies of postoperative pain with the help of a breath control have been reported, but fast or forced deep breathing can also increase the postoperative pain. Hence, slowly, smoothly, and gentle breaths help to reduce the pain, and it has been used as an adjunct to opioids after especially for coronary bypass surgery. Next is the music therapy. Music therapy is the clinically evidence-based use of music interventions to accomplish the individualized therapeutic goals, because music can be used for uh, in the various fields like preoperative, perioperative, and for chronic pain therapy. Uh, Perioperatively, music can decrease the preoperative anxiety, reduce intraoperative sedatives and analgesic requirements, and increase patient satisfaction. Patient-selected music can reduce patient-controlled sedative requirements during spinal anesthesia and analgesic requirements during especially lithotripsy. And music in the preoperative setting can reduce the anxiety without affecting the physiological measures of the stress. Music can also increase patient satisfaction and reduce the systolic blood pressure during cataract surgery after retrobulbar block. Perioperative music can reduce arterial pressure, anxiety, and pain among women undergoing mastectomy for breast cancer. As a non-invasive intervention, the low sensory stimulation of the music reduces anxiety and increased cooperation in children undergoing induction of anesthesia. Music therapy can be used as an adjunct for mm, postoperative nausea and vomiting, but record there are no published data for that. Um, Thank you, sir.
Right. Next. Very
Yes,
good.
sir.
Now,
Thank
the
you, sir.
first question with this: why this topic has been included in a so-called Bible for anesthetist textbook Miller? Why do you think this topic has been included?
Sir, it is included because it is an upcoming field. We are using it as an adjunct now. There are many data being published. Till now,
You think
FDA didn't
acupuncture and
approve.
acupressure are upcoming field? The Chinese have been
They are
practicing
already
for.
present, but they are not used as a conventional therapy, and it was not an approved treatment, sir, till now.
Okay. Is that the only reason? Which type of patients use this complementary or alternate type of treatment?
It's chronic
Exactly. So
pain
patients with
diseases.
chronic ailments are patients who have diseases which prevalently thought of as no cure is available. For example, a patient with end-stage renal disease. All of you would have seen in the YouTube somebody in Walajabad, somebody in Ranipet offering some spinach, and claiming that within 3 months you will get back your normal kidney function, and you won't need dialysis or transplant, all sorts of advertisements. And you find lot of treatment for infertility. You find lot of treatment for weight reduction treatment, and you find lot of advertisements for alternative therapy for chronic joint pains, osteoarthritis, saying that you won't require a joint replacement. All these things can be easily cured. Okay, so such chronic patients, because they are either dissatisfied with the initial allopathic treatment, try to seek help from other branches of medicine in despair to see whether they can be cured by these medicines. And the other reason why they have included in this topic in the textbook, I feel, is many a times during preoperative assessment, we anesthesiologists fail to ask them whether they are taking any other medications other than the allopathic system of medicine. And thus leads to an unexpected complications, mainly with regard to cardiovascular system, coagulation, or interfering with our drugs that we use for anesthesia. So these are the three major interactions or complications that are produced by these alternative systems or other complementary medicines which are used. I still remember listening to a lecture from a gynecologist from Africa who said that an African lady came for DUB bleeding and she was advised DNC. And even before surgery, she was bleeding heavily, and DNC is supposed to temporarily stop because you are curating the endometrium and there is no likelihood of further bleeding. It is considered as one of the initial steps in the treatment before you plan for a hysterectomy. But unexpectedly, the lady started bleeding more after the DNC, and she had to be transfused with almost 12 bottles of blood. And retrospectively, when they inquired with the patient, they found that that lady takes a lot of garlic in her diet every day. And this garlic has got an antiplatelet effect and fibrinolytic effect, as you mentioned in your answer. And that was the cause for the heavy bleeding that she had post a minor procedure like DNC. And then they had to transfuse a lot of platelets and then save the lady from going into a morbidity or mortality. So many a times when suddenly some complications happens in an otherwise assessed a patient who has been assessed as a ASA2 or ASA3, when you go into that sudden hypoglycemia, patient not recovering after GA, all these things could be due to the patient not revealing or the anesthetist not asking the history properly about the usage of complementary or alternative medications. Okay, so that is the reason probably why I think they have included this, because many patients, especially in the Western world, they are now going away from allopathy and trying to take treatment from other alternative medicines or other available health treatments. Now coming to, you have mentioned all about classification, everything is given nicely in Miller. And one point about acupuncture or acupressure rather is the usage of point P pressure for preventing nausea and vomiting. Did you mention that? That is
Sir,
been
for
described in,
post-operative, the P6, sir.
huh?
P6 stimulation, sir.
Yeah, that is been used or included in one of the, because post-op nausea and vomiting is uh, incidents occurring because of multivarious reasons. So one of the treatment that has been approved by our own people is the pressure at the, which is the point where you have to apply the pressure for reducing the severity of nausea and vomiting. Do you know the location?
Sir, P6, sir, it is two and a half finger breadth from the wrist crease between the palmaris longus tendon and the tendon, sir.
Palmaris flexor carpi, I
Flexor
mean,
carpi radial.
Plus or kappa radialis and palmaris longus
Palmar.
proximal to the wrist, proximal wrist crease. Okay, that is the point that we have to
Yes.
remember that is used for that. So these are the reasons I think. So you must make it a routine habit or include in your pre-anesthetic questionnaire whether the patient is
Okay.
taking any other medicines other than the allopathic medicines prescribed, especially when they have comorbidities like osteoarthritis or chronic diabetes or CK renal disease. All these patients you must ask. And some of them will tell you that they took the treatment and they are still continuing. Some of them will say they took the treatment, they found something not agreeing with them and they stopped it also. So the duration of the interval between stopping the drug and the time of surgery is very important. And if they are continuing to take those treatments thinking that that will also help them, we must know when to stop them. So three important complications that we encounter with the other system or herbal medicines that the patients are taking are: one is with regard to mainly the coagulation system, the second is the cardiovascular system effect like hypertension and arrhythmias, and third is the metabolic like blood sugar variations. So we must keep this in mind so that we can avoid unnecessary complications by asking a simple question whether the patient is taking any other medicines other than allopathic medicines. So after you have described all these things verbally, I think by looking at the slides, it will be more